Hello everyone, welcome back to my channel. In this video we will see about the anatomy of hand. So in hand we have a bony framework which is composed of the 8 carpal bones, 5 metacarpals and 14 phalanges. So these are the carpal bones and there are 5 metacarpals. They are numbered from the thumb side. So the first metacarpal is the metacarpal of the thumb and the fifth metacarpal is the metacarpal of the little finger. Then we have 14 phalanges, 3 in every digit and 2 in thumb. So these are the carpal bones. A is the scaphoid, B is lunate, C is triquetrum, D is pisiform, E is trapezium, F is trapezoid, G is capitate, H is hamate. So these are the 8 carpal bones. Now the anatomy of the carpal tunnel. The carpal tunnel, it is having a boundary which is bounded posteriorly by the carpal bones and anteriorly it is bounded by the flexor retinaculum. So in the diagram we can see the posterior boundaries. This is formed by the carpal bone and anteriorly it is bounded by the flexor retinaculum. Then the contents of the carpal tunnel. These are composed of the flexor tendons as well as the median nerve. So these are the structures which are passing through the carpal tunnel. Then the structures which are passing superficial to it, these are the palmar cutaneous branch of the median nerve, the superficial branch of the radial artery, the tendon of palmaris longus, the palmar cutaneous branch of the ulnar nerve, and the ulnar artery and the nerve. Now the important structures which are found in hand, these are basically composed of the bones and the joints, ligaments, tendons, muscles, nerves and blood vessels. So as we all know, the palmar side of the hand lies anteriorly and the back of the hand is known as dorsal side of the hand. Now on the palmar side we have palmar aponeurosis, which is a strong fibrous sheath, triangular and occupies the central area of the palm. It is having an apex. This is the apex, this is the base and 2 borders, that is the medial and this is the lateral border of the palmar aponeurosis. The apex is continuous or it is blending with the flexor retinaculum and it is the continuation of the palmaris longus tendon. The base lies at the bases of the medial 4 fingers and this divides into 4 digital slips. Each digital slip further divides into superficial and deep straits, that is 2 layers, superficial and the deep fibers. Superficial fibers joins with the dermis and blend with the superficial transverse ligament of the palm, while the deep fibers divides into 2 bends and attaches to the deep transverse ligament of the palm, palmar ligament of metacarpophalangeal joint, bases of proximal phalanges and fibrous flexor sheaths. The applied anatomy related to the palmar aponeurosis is Dupuytren's contracture. So in this contracture there is a localized thickening and contracture of the palmar aponeurosis, and this starts near the root of the ring finger and draws that finger into the palm, flexing it at the metacarpophalangeal joint. Later the condition involves the little finger also. Then we have the flexor retinaculum. This flexor retinaculum, it is attached on the lateral side to the scaphoid and the trapezium bones, and medially it is attached to the hamate and the pisiform. Then this is the extensor retinaculum. Laterally it is attached to the anterior border of the lower end of radius and medially it is attaching over the pisiform and the triquetral bones. Then the muscles of hand, these are categorized into 2 types. First is the extrinsic muscles. So they are located in the anterior and the posterior compartments of forearm and they are controlling the crude movements of the hand. that is the power grip. Then intrinsic muscles, they are located within the hand itself and they are responsible for the precise movement of the fingers and the thumb. These extrinsic muscles, these are the long flexor and extensor muscles of the hand and they are taking origin from the forearm. Now the intrinsic muscles, these are composed of the palmaris brevis, adductor pollicis, thenar muscles, hypothenar muscles, interossei and the lumbrical muscles. So in the hand we have two elevations. On the lateral side at the base of the thumb we have thenar eminence. On the medial side at the base of little finger we have hypothenar eminence. Opponents and abductor muscles, they allow the movement of thumb and the little finger to move across the palm and the back. So these are the muscles. Now first we discuss the thenar muscles. In the thenar eminence we have opponens pollicis, which is arising from the tubercle of trapezium and the flexor retinaculum. In the diagram we can see this green colored muscle is the opponens pollicis and this is inserting over the lateral margin and adjacent palmar surface of the first metacarpal. This is innervated by the recurrent branch of the median nerve. The action of this muscle is medial rotation of the thumb, that is apposition. Then this blue colored muscle is the abductor pollicis brevis. It is also arising from the tubercle of the scaphoid and trapezium and the adjacent flexor retinaculum, and this is inserting over the proximal phalanx and the extensor head of the thumb. This is again innervated by the recurrent branch of the median nerve. As the name indicates, the action of this muscle is abduction of the thumb at the metacarpophalangeal joint. Then this red colored muscle is the flexor pollicis brevis. This is again arising from the tubercle of the trapezium and the flexor retinaculum, and it is inserting over the proximal phalanx of the thumb. The innervation is same, that is by the recurrent branch of the median nerve, and the function is flexion of the thumb at the metacarpophalangeal joint. So these are the various movements of the thumb: the abduction, adduction, then apposition, flexion. Then we come to the muscles of the hypothenar eminence. As we have discussed earlier, hypothenar eminence is the elevation at the base of little finger, and the muscles of this eminence, they are innervated by the ulnar nerve. These muscles are, first is this opponens digiti minimi. This arises from the hook of Hammett and the flexor retinaculum, and it is inserting over the medial aspect of fifth metacarpal bone. The innervation is provided by the ulnar nerve and the function is lateral rotation of the metacarpal, fifth metacarpal. Then the second muscle is abductor digiti minimi. It arises from the pisiform bone, pisohamate ligament and the tendon of flexor carpi ulnaris. It is inserting over the proximal phalanx of the little finger and the function is abduction of the little finger at the metacarpophalangeal joint. Then the third muscle is this green muscle, that is flexor digiti minimi brevis. It is again arising from the hook of Hammett and the flexor retinaculum. As we have seen, these all muscles are arising from the hook of Hammett, except the extra origin of the abductor digiti minimi is through the pisiform bone and the pisohamate ligament. Then the insertion of this flexor digiti minimi brevis is on the proximal phalanx of the little finger. Innervation is same, that is by the deep branch of the ulnar nerve, and the action is the flexion of the little finger and the metacarpophalangeal joint. Then we have the interossei muscles. These are located between the carpal bones, that is why they are named as interossei. Inter means between the bones. So we have two types of interossei. One is dorsal interossei, which is most superficial of all the dorsal muscles and can be palpated on the dorsum of hand. These are 4 in number. Palmar interossei, these are located on the anterior aspect of the hand and these are also 4 in number. So these are the palmar interossei. The first and the second palmar interossei, they are arising from the medial surface of the first and second metacarpal bones. The third and the fourth palmar interossei, they arises from the lateral surface of the shaft of fourth and the fifth metacarpal bones. They are inserting into the extensor hood, that is the tendon of extensor digitorum longus, and they are also inserting on the base of the proximal phalanges of the respective fingers. These are the dorsal interossei. They are arising from the adjacent sides of the metacarpals. That is, the first dorsal interossei, it arises from the adjacent side of first and second metacarpal. The second dorsal interossei arises from the adjacent sides of second and the third metacarpal. The third dorsal interossei arises from the adjacent sides of third and the fourth metacarpal, and the fourth dorsal interossei arises from the adjacent side of fourth and the fifth metacarpal. The insertion is same as that of the palmar interossei, that is in the extensor digitorum longus tendon, that is your dorsal digital expansion. Through this expansion, they are inserting into the bases of proximal phalanges of the respective fingers. The innervation of these muscles is via the deep branch of the ulnar nerve, and the action is different. The dorsal interossei, their action is abduction. This can be memorized with the help of this mnemonic, that is DAB, DAB. Dorsal interossei, AB means abduction. And the palmar interossei, they are doing the adduction of the fingers, and this can be remembered by this mnemonic, that is PAD. P for palmar interossei, AD means adduction. Then we have the lumbrical muscles. So these are the lumbrical muscles. These are also 4 in number. First and second lumbrical muscle, they are unipinnate. Third and fourth lumbricals, these are bipinnate muscles. These muscles are arising from the flexor tendons, and they are inserting into the dorsal digital expansion. And the innervation is the medial 2 lumbricals, these are innervated by the ulnar nerve, and the lateral 2 lumbricals, these are innervated by the median nerve. The action of these muscles, they are doing the flexion at the metacarpophalangeal joint and extension of the interphalangeal joint. So this action is used when we hold a pen or a pencil. So this action is done by the lumbrical muscles. Then we have some other muscles in the palm, that is the palmaris brevis and adductor pollicis. So this adductor pollicis muscle, it is having 2 heads, one is transverse, other is oblique head. The transverse head arises from the shaft of third metacarpal bone, and the oblique head arises from the capitate and the bases of second and the third metacarpal bones. And this is inserting over the base of proximal phalanx and the extensor hood of the thumb. And it is innervated by the deep branch of the ulnar nerve, and as the name indicates, the action is adduction of the thumb. Then we have palmaris brevis, which arises from the palmar aponeurosis and the flexor retinaculum. This is a subcutaneous muscle, so it is inserting in the dermis of the skin on the medial margin of the hand. It is innervated by the superficial branch of the ulnar nerve, and this is meant for improvement of the hand grip. Then these flexor tendons of the extrinsic muscles in the hand, they are enclosed within a synovial sheath. This synovial sheath is termed as ulnar bursa, as we can see in the diagram. This blue colored structure, which is enclosing the tendons of medial forefingers in their proximal aspects, this is the ulnar bursa. And the radial bursa is again a synovial sheath which is enclosing the tendon of flexor pollicis longus. This is a separate synovial sheath for the tendon of flexor pollicis longus. Then we have clinical related to this, that is the trigger finger. Trigger finger is also termed as stenosing tenosynovitis of the finger. Synovitis means the inflammation of the synovial sheath which is enclosing the tendons. This is caused by a nodule or thickening of the flexor tendon, which catches in the proximal edge of A1 pulley. A1 pulley is here the ligament at the metacarpophalangeal joint. So whenever there is inflammation of this sheath is forming a nodule, and this nodule is encased in this A1 pulley, and this causes the active flexion of this finger and hold this finger in this position. In this position the finger is bent and it is termed as trigger finger. Then we have the anatomical snuff box. It is nothing but a triangular depression on the lateral aspect of the wrist. It is observed during full extension of the thumb. The medial boundary of this is the extensor pollicis longus, and the lateral boundary, it is bounded by the abductor pollicis longus and extensor pollicis brevis. The roof of this snuff box is by the cephalic vein and the superficial branch of the radial nerve. The floor is formed by the scaphoid bone, as we can see in the diagram, and the content of this box is the radial artery. Then we have the fracture of the fifth metacarpal bone, which is termed as the boxer's fracture. Usually it is observed in boxers because of their boxing action. There may be a fracture of the head of the fifth metacarpal. In the next video, I will discuss about the rest of the part of the hand, that is the palmar's faces. So in this video, I have discussed about the muscles, their actions, attachments, and related clinical anatomy. I hope you understand well. Thanks for watching.